The healthcare sector has always been reluctant to jump into new technology. After all, its people's lives are at risk. But now experts say technology and innovation can improve healthcare. They say innovative use of artificial intelligence, Internet of Things and robotics can save lives. The issue will be discussed at the 7th Annual Healthcare Innovation Summit Africa in Johannesburg. Let's discuss this further with Abe Wakama, who joins us from IT News Africa. Thank you very much for joining us this morning. And maybe just give us a brief sense of what is the summit is all about and really some of the important themes that are going to be unpacked.
Well, really, the summit is meant to bring together healthcare professionals and service providers, technology service providers, to discuss the impact of technology on the industry. And so what we're seeing is that there's been a massive shift in terms of the use of technology, particularly after COVID. You and I today can probably get to see a doctor over the internet today, and that was something that people didn't do quite often before COVID. And also we can see that with technology, for instance, a few years ago I visited the urology hospital somewhere in Pretoria, and I tried to get my medication, and the pharmacist put in my prescription, and a robotic arm actually picked up my medication and dropped it. And this was a few years ago, and I was blown away. And so robotics is something that's already in the system. We're seeing a lot of artificial intelligence coming through as well. And so it's important for industry players to understand how technology is going to change the face of healthcare going forward.
Yeah, it's such an important thing that you raised there in terms of the benefits of healthcare. And you mentioned the robotics at the pharmacy.
Yeah.
And I had to use public healthcare at one point. And the nice thing was that the doctor had access to all my tests that I had done on his cell phone, right?
Yes.
So that was also quite interesting. And I saw the importance of that. But overall, I find that there is a lack of urgency from government side to provide the necessary resources.
Yes.
And I find that that's perhaps not just the situation in South Africa, maybe other parts of the rest of the continent as well. In your opinion, and just based on your engagements, why would you think that reluctance still persists?
Look, in some cases it's just a question of legacy systems already being in place and getting rid of old systems and bringing in new systems. It's government bureaucracy and all of that. That could just be the issue. Again, it's about information. We or people in the industry need to inform government of the benefits of transforming, of digitally transforming, and how it would benefit the end users as well as the practitioners. So it's important that everyone in the industry gets together, gets to understand the benefits of using technology, and we have a role. Our role is to sell these ideas to government, and I think it's important. At our conference, we try to have a balanced audience. So we have people from the public sector, we've got policymakers, we have technology service providers, as well as startups. Last year we had the company Zipline, and they're responsible for moving medication via drones from urban centers to rural areas in Kenya. And so those are the kind of solutions that people can expect to see when they attend the Healthcare Innovation Summit Africa.
And what about the conversations around skills? Because there needs to be a reskilling of those that practice within the healthcare sector to be able to use the machinery or the technology that you've just described for us. How important a component is that conversation at the summit?
It is very important. I mean, earlier I spoke about robotics in the healthcare space. That's maybe someone's job that's no more available now because the robot has taken that job. But then we need to reskill whoever had that job to do something else. Maybe they need to figure out how to program those robots instead. So I think it's important that we understand where the healthcare sector is going from a technology point of view and what sort of skills will be needed in the future in terms of analytics and understanding artificial intelligence and robotics and all of that. Definitely our curricula here in South Africa and the rest of Africa, we really need to look at what we're teaching our students and get them up to speed on the latest technologies. Yeah.
And then finally, and very briefly if you could, realistically, looking at the South African context, would you say that we are on a solid path to see some form of hybrid model between traditional ways of doing things and a healthy contribution from technology and other IT systems in the short to medium term? Do you find that there's a willingness to push for public health in particular to go in that direction, maybe to see that in the next 2-3 years?
Well, I think there is hope. We've seen a willingness, particularly at our conference, on the part of government officials. We've had MECs from different provinces of health in different provinces attending this conference. The individual responsible for e-health in this province, Gauteng, is going to be at this conference as well. There's a willingness to embrace new technologies. Maybe there are challenges within their systems that are not allowing them to implement these things as quickly as they would like to, but there is a willingness to learn. We've just talked about, again, robotics, and I think there is hope. We're seeing changes as we go along, and things are happening.
Thank you very much for your time. And I didn't ask you, is it Abe or Abe? Because I introduced you Abe.
No, it is Abe.
Oh, I got it right first time. Thank you very much for joining us this morning. That is Abe Wakama from IT News joining us this morning to give us a sense of the importance of technology in improving healthcare in South Africa, but also the efficiency of providing healthcare in the country. And